So good afternoon to all. So today's class we are going to discuss on role of medical social work in occupational health problem. Okay, so previous class we have seen on what is the psychosocial problems in occupational health problem and other concepts. Okay, so let's see the first and foremost and most important role of a medical social work in occupational health problem. First is health education and community participation. So what is the meaning of health education? Health education means so giving them the education about the health. It may be nutrition or it may be hygiene or it may be any kind of prevention from their occupational hazards. So it's called as health education. Next is the community participation. Community participation means we should participate in particular community or maybe so say for example in one area. So there will be a certain amount of people who are working in a company. So so that's called a community. So we can involve the community in a particular participation. So it's kind of maybe kind of any kind of awareness. So next is a prevention of health hazards in the source. So the area where the workers are working, so social worker can inspect the areas with other officials. Say for example, so some companies, so safety officers will be there to access the hazards. So on that cases, so social workers accompany with them. So that's the next point. That's called teamwork. So we can accompany with them. We can go through the sources areas whether the hazards are more or not. So if hazards are there, so what are the prevention measures should be taken to prevent the health hazards? So next is teamwork. Next is equity. Equity means each and everybody are treated as equal in the employees and as well as the in a hazard point of view. So every employee should be treated as equal. Say for example, in superior officers may be a different kind of environment and workers have a different kind of environment, not like that. Everybody treated as equity. Next, accessibility. So next, accessibility in the sense, if any kind of hazards are took place, so the employees should have easily accessible to the particular hospitals or particular medical professionals or particular any kind of helpers. So next is affordability. So affordability means the worker should have a affordable to for the medical expenses if they face any kind of hazard problems. So next is access employee social, economic, emotional, environmental, financial and support needs. So this is a very important role of a social worker. What is this? The social worker has to assess the employee's social, what kind of social support he has, what kind of social background he has. Okay, so what kind of family support he has. So everything is come under the roof of social aspects. Next is emotional. So how the employee is feeling towards the job profile, I mean the job area or to the job role, how is emotionally is feeling comfortable or not, he is feeling well or not, so he can be able to cope up with the working environment or not. So next is environmental aspects. How is the working environment for him? Whether there is a proper ventilations for him, proper air circulations for him or not. Whether how is in surroundings, whether it is hygienic or not. So these all are have to access by the social worker. Next is the financial aspects. So how the employee is earning, whether he can able to fulfill his basic needs or not, whether he can able to afford certain basic needs such as food, shelter and clothes. This other is support needs. What kind of support he has in the job area or in the family. So these are all have to access by the one and only medical social worker. So next is inform other members of the healthcare team about these factors. So another important need is some healthcare professionals they not know the social background of the patient, don't know the emotional background of the patients. Why? Because the healthcare team they only have to concentrate on only the health aspects. So now the trend are changing like that. Why all the good old days they used to concentrate on every aspect of the patients. So there is no need for professionals for that. But now the trending are changing. Now the medical professionals are only carrying particular aspects on that. So other social or emotional, environmental, financial will be taken care by the social workers. That's how the social worker gave a birth. Okay, so the social worker should inform the other healthcare members or healthcare professionals about the social background, emotional background and environmental and financial support needs to about the employee to the healthcare team. So how is it help? How it can affect the employee's health in the particular job area. So the healthcare profession should know everything. Okay. So next thing is work with the employees, family and other service providers and agents to develop a plan. Okay. So social workers should work with the employee's family also. So what kind of work he has to do? So he has to observe whether the family can able to cope up with the work timing of the particular employee, whether the family can able to cope up with that or not, whether the family going through any kind of problem. Say for example, if the employee is working in a chemical factory, so in that cases, so he can develop any kind of skin problem or any kind of respiratory problem. So in that cases, how the family is coping up with an employee's medical expenses and other kind of medicines expenses, whether they are able to cope up or not. Okay, so in case of what can be done, so in case the family can't able to cope up, so what can be done, plan for the care of the patient. Okay, so these are all were concentrated and work is done by the medical social worker. So next is awareness about the safety in occupation, preventive measures. Okay, so next is an occupational hazard surveillance. So another thing is, the social worker has to give an awareness about the safety in occupations. So not only social workers can also do, so safety officers are designated in some companies and some projects, whether they have to teach them. So how the safety measures can be taken to avoid the hazards. Okay, so the social workers, they can give the safety awareness, or the other professionals, the social worker can work with them as a team. Okay, so they can give them the safety measures to the employees, as well as what are the preventive measures can be taken to avoid the hazards. Okay, so next step is surveillance. That's called a survey. Okay, so occupational hazard surveillance, in a sense, the all over the company, the social worker can do a surveillance in the how the hazards are there, whether they have any kind of hazards or not. Okay, so next and more important, foremost and very important role of a social worker is counseling. Okay, so in case any kind of problem has occurred, okay, in employees or due to employees to the family, the social worker can counsel the patients. Okay, so they can do a follow-up visits also. So counseling is about 7 to 8 sittings depending on the problem of the employee. Okay, so social worker should follow up. So how if the first session is over, so how the patient is feeling, whether he is feeling emotionally fit or not, whether he can able to cope up with situations or not. If not, so what can be done? What kind of follow-up mechanism can be done? What are the follow-up techniques can be applied, or what kind of counseling techniques can be applied on the employee so that he can feel comfortable? Okay, so that's called follow-up visits. Next, referral system. Say for example, if the employee is suffered from any chronic illness, okay, so on that time, social worker can refer the patient to the concerned medical professionals, and he can tell them what kind of background he has, what kind of emotional background he has, what kind of social background he has, okay, what kind of financial. That's what I told you in that particular point. That access employees inform other members of healthcare system. Okay, so the social worker should refer at the same time. He have to inform to the particular health professional about every aspect of the employees. Right. So next is case maintaining. So at last, the social worker should maintain the case. Okay. So if the patient has a certain 10 members of employees related to any kind of emotional problem, on that cases, the social worker should maintain the case properly. It may be manually maintained, or it can be systematically maintained. It may be hard copy, or it may be soft copy. But the thing is, the social worker have to maintain the cases properly as per the particular company norms. Okay, so this finished the role of MSW in occupational health problem. So next we are going to see on the role of medical social worker and the women health problem. Okay, so social worker embeds a view of women health and holistic and consider the women's social, physical, emotional, cultural well-being. So what are the aspects where the women is particularly get affected? That is the social, physical, emotional and cultural well-being. Okay, that's called holistic approach. Okay, the social work should embrace the view of health in a holistic approach. Okay, that's a point of the first. So first point of the role is counseling and support for the family. Okay, so the first thing is the social worker has to counsel the women. If the women is suffer from any kind of health problem related to the social or related to, later on we will discuss about the detail, but like I am telling you the basic things like a broad view of every problem. Okay, if the particular woman is suffering from any kind of physical problem, physical abuse or physical violence, So on that time, the social worker has an important duty to counsel the women. Okay, so find out what is the exact reason. Okay, so depending on that, what other support can be done for the women as well as for the family. So next is the information referred to the other services. So next this thing is the to gather the informations of the particular women and refer the women to the other services. Say for example, if the patient is suffering from any kind of pregnancy problem. Okay, so on that time, a social worker can gain the information. What is the problem actually, and he can refer the patient to the OG department for pregnancy management. Okay, so next is preparation for discharge from the hospital. In case if the patient is admitted in the hospital, so the social worker can prepare for discharge. Okay. He can assess whether the patient is feeling comfortably or not. If the patient is feeling comfortable, the patient can discharge. So the social worker should plan how at what time the patient should be discharged and what are the preparations can be done for the discharge from the hospital. So next is the advocacy on behalf within the hospital community. So advocacy means to giving the awareness about the rules, schemes and laws. Okay. So as well as in the hospital, as well as in the community. So the social workers advocate the women in the hospital also, as well as in the community also. Next is the group work. Okay, so what is group work? So group work is to gather some women's group and give them some theme and to discuss within them. Okay, so find solutions within them. That's called a group work. Okay, so the social worker can conduct a group work and maybe more than 13 to 20 women. Okay, so give them some kind of theme to discuss within what kind of measures or what kind of problems they are facing. Okay, so next is community education and training to health workers about the women health issues. Okay, so next thing is give the community education to the communities. In certain areas, women population will be more compared to the men. Otherwise, the women are more vulnerable. Okay, to the vulnerable compared to the men. On that area, the social worker has an important work to study in a particular area. Okay, to do research in a particular area. Okay, so what are the problems the women are facing? Depending on that, the social worker can give community education. Okay, so training the health workers. So maybe some health workers are lack of aware about the women health issues. So because social workers know the health issues, so the social worker can train the health workers about the women health issues. Okay, so next point I told you, that's the research regarding the women health issues. Okay, so the social worker should do research on the in community level, hospital level, or as in the individual level. The social worker has to do research on that and to find out what are the women health issues. Okay, so next is antenatal and postnatal support. So social worker can give the antenatal and postnatal support also. So next is support when you go from the hospital. So when the women are discharged from the hospital, so what kind of support we can give? So he should support and the feelings of isolation, depression or anxiety. So next thing is this is a psychosocial problem of a woman. Okay, so psychological problem is feeling of isolation. Okay, so social the women feel isolation in some cases. Okay, or depression, anxiety. Okay, concern about the current past experience of the family violence. Okay, this is called also a psychological problem. That is feeling about the current and past experience. Maybe the woman has some worst experiences regarding the family violence and past experience of the family violence. So next is counselling and advocacy for the women with cancer. So some women are suffering from cancer. On that cases, the social worker advocate the women and give counselling to the women. So unplanned pregnancy. So some women they have a not proper plan about the pregnancy. On that case, social worker can help them to plan for that. Okay, so pre-women support, miscarriage, stillbirth, neonatal death. So social workers can give them support related to the miscarriage, stillbirth or neonatal death. Okay, so next support if baby had disabled or health problem. Okay, if the baby is disabled, what can be done? What are the measures or what kind of duties can be done to for the disabled children or health problem children? So next is referral. For all these problems, so social worker has to refer to certain departments. Okay, so next is the social worker are available to see the women. Currently, patients can ask doctors or nurses to make reference. See, social workers are available to see the women who are currently the patient. Okay, the social workers are always available in every hospital. Okay, so in case a patient can ask the doctors to so that I can to make referral to the social workers. That's called a referral system. Okay. In some cases, no, maybe the patient cannot see the social workers. On that cases when the patient directly approach the social workers, no, so doctor should refer the patient to social worker. Okay. The psychosocial and practical support for the women through the maternity and neonatal gynecological cancer. So the social worker should give a psychological support, social support, as well as a practical support, means any kind of family supports can be given to the women with the maternity, neonatal, gynecological cancer experience at the women. Okay. So next is the counseling, support, discharge planning, advocacy for the women, the response to health and social needs. So these are some important. Okay, counseling can be given, support, what kind of support can be planned for the women, and discharge planning, when to discharge, how to discharge, okay, who are all coming to receive the patient and advocate the women in response to the health. Okay, there are any kind of social needs they want. Okay, so next is the women and their babies from diverse background provide support to the women with the complaints. Okay, so next thing, so the women should know when they have to come for the review, follow-up visit for the children as well as for the mother, and what are the medical needs can be done, what did they want. If they say for example the patients have a lack of financial needs, so that we can engage them with the government so they can get free medications and medicinal needs and social, what kind of social needs they want. Okay, so these are some important role of a social workers in women health problems. So next we are going to see psychosocial issues. Okay, so these are some beautiful chart in which you can see what are the social issues, cultural issues, economic issues and health issues. Okay, we will just I have given you this whole diagram for your information, but in this you can just know what are the health and cultural economic issues for the women health problem. But we are going to concentrate only on the social. So what are the social problems in that? First is social developmental schemes. Okay, so whether the women have any kind of scheme for if the say for example if the women give birth to 2 girl child, so they have some good schemes in Tamil Nadu, whether they can get 25,000 money and some kind of golden ring for them. Okay, so that's whether they are aware about the schemes or not, whether they have permanent housing or not, whether they have a community support system, whether community support in a case of family support or other things. Next is in education, early marriage, prenatal care, social euthanasia. Social euthanasia is kind of a stigma, social cohesion, household ethnicity. Okay, so these are the social. Other thing, lack of decision. Though the women decisions are not considered in the family. Okay, next is making capacity, cruelty, and social respect, law protection, gender equality, terrorism. So these are some most important social aspects. You can just by heart or learn these points. If you want to know the meaning, you can just refer the textbook. Okay, so that's given you the general points in that. Okay, these are the psychological problems that the women are facing. First is depression. So depression, mana artham. Okay. Next is self-harm. So when they become depression, for their peace, so they usually do self-harm. That's a kind of expressing their angriness. Okay, so they'll self-harm their own body. Next is anxiety, fear about any kind of situation, maybe violence or anything. Next is suicidal thoughts. So women are facing suicidal thoughts also. So next are alcohol and substance addiction. So when city girls, I didn't see in village, some city girls, they used to have alcohol and substance addictions to relax themselves. Okay, next is bipolar disorder. So body dysphoric disorder. That's body dysphoric disorder means the body will not like an actual girl. Okay, so combined to their big group, the body shape will be somewhat over thin or over fat. Okay, that's called dysphoric. You can just Google it and see what is the exact meaning. Okay, just I given you the names. That's borderline person disorder. Okay, next abuse. Another thing is a psychological problem, abuse. Okay, so why it's considered actually abuse isn't this now social, but when the abuse happens, okay, automatically led the girl to the psychological problem. That's what I'm going to tell. Okay, because say for example, rape victim is there. Okay, he faces an worse situation in life, that's called rape. So when the rape has occurred, the victim will be in a depression, or it may be in a kind of anxiety thought. She should fear to roam in a community, or he had fear by seeing the boys. Okay, he might feel like a phobia. That's called a psychiatric disorder. Okay, so another is body image, how you think, feel about. That's what I do. That's called body dysmorphic disorder. That's the body image, how the girl body image is like, how you feel about his body. Okay, so these are the psychosocial problems of the women health as well as the role of social work. So next we are going to see what psychological issues in a pediatric health problem. Okay, so what? Okay, fine. So first, psychological issues of pediatric health problem is anxiety disorder. Okay, just go through. I will give you the notes. Okay, so this is anxiety disorders. Anxiety disorders, the children persistent fear. Anxiety is also known as a fear. Okay, so that is attention deficit and hyperactivity. Some children are very hyperactive in certain this thing. If you go through this, you can easily understand. Okay, so next is autism and spectrum disorder. Autism spectrum disorder, neurological conditions that appear in early childhood. Okay. So what is a disorder? So it's a difficulty communicating, interacting with the other groups or within the peer groups. Okay. Another is eating disorder. So maybe not within the eating disorder means he will not concentrate on his weight or weight loss or weight gain or unsafe eating, diet eating. These are all considered under eating disorders. Okay. So next is depression. The depression of the mood. Okay, the depression is a persistent dependent mood. Bipolar disorder and mood disorders are more or less somewhat same. Why? Because mood disorder means the suddenly swing in the mood. The patient will be happy, suddenly he will become angry, suddenly he will become aggressive. That's called a mood disorder. It's depending on the depression stage he has. Next, post-traumatic stress disorder. So that is an emotion distress, anxiety, distressing memories, nightmares, and disruptive behavior. Okay, so by these nightmares and emotional and anxiety, so the patient has behavior will be changes. Okay, it become very violent, it become very abusive. Okay, this is called post-traumatic stress disorder. Next is schizophrenia. Schizophrenia is a disordered perception, thoughts that causes any person to lose touch. That's schizophrenia means he loses the feelings, he loses the perception. Okay. The obviously is called also psychosis, right? Okay. So next thing is oppositional defiant disorder. See, when the children are act persistently, so that they cause a serious problem at home. Okay, so they are so there will be the behavior of the children will be not there will be persistently cause a serious problem at home. The behavior. See, actually, the behavior, what kind of behavior cannot be stated, but the behavior will be different compared to their play group. So it may create problems in the school and home and with the peers. Okay. So what are the examples for the ODD behavior? That is being angry, okay, arguing, and arguing with the peer groups and refusing denial. Next is conduct disorder. Conduct disorder is diagnosed as when the children show the ongoing pattern of aggression towards others. That's what. So the children should be very aggressive behavior to the others. So example of CD behavior include breaking serious rules. They should break the rules. Okay, they should be running away from particular classes, or they skipping the schools. Okay, so being aggressive, lying, stealing, damaging the properties, bullying, fighting. These are all being cruel to the animals. So these are the conduct disorder. Okay, so these are the some psychiatric disorders. So the psychological issues. Next we are going to see the social issues. Okay, first is the first thing is the so first social issues is when the children, when the small boys, whether they lose their loved ones, maybe father or mother, or maybe bullying or others, this or any kind of illness, this lead to some kind of social issues. Okay, so when they face this kind of these things, so they'll automatically feel like. So these are see, first is divorce and events directly affect the children, natural disasters, wars or terrorism. Okay, so these are the some fears. Okay, so other is youth suicide. So these are some general points. You can just go through it. Okay, do no need for explanations and all. Okay, so these are the some see the physical abuse, negligence, social abuse, abandon the children. Okay, poverty, lack of adult supervision. Okay, racism, discrimination. Okay, social exclusion means to exclude the children. Drug use, violation, chronic stress, physical abuse, sexual abuse, and abandonment, poverty, lack of adult supervision, racism and discrimination. Discrimination means racism means depending on the color they are discriminated. Okay, so racial disparities in children, disability, violence at the school, social media, not enough job for the parents, automatically lead the particular child to the child labor. Okay, unsafe housing. So these are the some important social issues in this. Okay, so what are the role of pediatric health problem? Okay, so providing counseling and support to adjust the illness and grief in kind of they have lost their loved one, no? Or their illness, so give them a counseling and support to overcome the grief. Okay, proper crisis intervention. So in case they are facing any kind of crisis, what are the intervention can be done? So giving them the crisis intervention, assisting with the communications between the family and medical team. Okay, the family and medical team, the social worker should act as a mediator between both of them. Okay, so advocating the child, family on medical treatment, other services, connecting the community resource and trauma service. So connecting the community resources. Okay, so social worker should work as a connection between the community services as well as the hospital or trauma in a sense it's a kind of an psychological service. Okay, participation, discharge planning, so providing the emotional support, care coordination, connection to the important resources. Okay, and communicating with the medical team. So these are some important emotional support and counseling, helping the young patients to cope with their family's emotional and psychological trauma. Trauma means a kind of a shock. Okay, provide wide variety of services, access the family really limited knowledge. You can just understand by reading this. Okay, the next is psychoeducation and support, giving them psychoeducation. Pediatric social workers provide the families and compassionate support and short-term counseling. Okay, during this kind of any kind of confusion they have, the confusion may be any kind of emotional support or psychological trauma, no? On that confusions, no, and then anxiety, vulnerability, the social worker can give them the counseling and compassionate support to the child as well as the family. Okay, so they can apply the psychotherapeutic methods also. That's the cognitive behavioral therapy, psychoeducation, mindfulness-based stress reduction, supportive psychotherapy. So these are provided by the social worker. Okay, next pediatric social workers help the family comprehend their situation, overcome their family situations. Social worker coordinate the patient care, communicating, helping the organizing all parties, influence the patient medical treatment. Okay, the social worker serve as a point of contact between the not only with the families and the medical team and the medical and non-medical team. Social worker serve as a point of contact. So contact not only with the patient family but also with the patients and the medical members, non-medical members. So social worker schedule facilitate meetings with medical teams between the. So social worker should this is the most important thing social worker should do in a pediatric field. That is, the social worker should facilitate a meeting between the medical team doctors and the patient family, so they can interact with each other and they can ask doubts and solve the problems. Okay, so social workers should guide the other members, hospital staff who provide sensitive, compassionate. Social workers should guide other medical teams to give a compassionate services to the pediatric and effective care to the pediatrics as well as the families. Okay, so social workers deeply connected with the organization. So most important thing is the social workers is connected with the other organizations also. Organizations may be NGOs who are working in the pediatric sector, and NGOs like counseling NGOs or family advocacy projects. Somebody are doing advocacy on the family, or somebody giving the family therapy, somebody giving the counseling, family counseling. No? So you should have a close contact with an organization. In case of any referral can be done, no? So social worker can refer them to the nearest organizations. Okay, so this is the classes gets over for now. For my next class, we will concentrate on the social issues of geriatric health and role of MSW in MSW geriatric health. Okay, that's after this one, unit 4 is going to get over. Afterwards, we will concentrate on the unit 5. Thank you.